Hello and welcome to our educational series provided by the Berks County Area Agency on Aging. This series is medication in seniors and all about that with a variety of topics. We have 3 segments to this series, and today's segment specifically is regarding communication with the healthcare professional, particularly as it revolves around medications. I'm excited today. My guest with me is Dr. Ruxandra Jadic, and she is the Section Chief of Geriatrics with Reading Health System. Welcome. Thank you so much for being here. I'm excited. We've got a lot to talk about, and I welcome you. My name is Barlet, and I am the Public Advocacy and Outreach Manager for the Berks County Area Agency on Aging. This ties in nicely. We talked first earlier, Dr. Jadic, in another show about medications, and it was all on a lot of the programs, the plans, and the costs of those. And as we move forward, that we also know that in order to get that, we have to talk with our physician and visit our physician on a regular basis. And so today's topic is really communication, and particularly how to do that, and talk about some of those things, tips that are important for good communication, and as it relates specifically to medications, because sometimes we've heard in our agency and many places about the problems with medications and the misuse, and I think some of it's in the miscommunication. So obviously it's important to have good communication with all of the healthcare professionals in general. So let's talk about, let's start with that. Just give a basic, we talked a little bit before. Why is that just so? It's such a key to have good communication just in general with all the healthcare providers.
Well, certainly communication is important in any areas, and certainly with your physicians. And lack of communication, mostly when it comes to medication use, can lead to very serious problems. When let's say the physician the patient is not giving enough information to the physician to make a decision, often things get overlooked. Like, let's say previous medication that the patient maybe takes and didn't take the physician. I just saw the cardiologist yesterday. He gave me a new pill, but I don't feel like, I forgot to tell you. or conditions that maybe the patients don't think that may be relevant to tell the physician they have. Mm-hmm. Certainly that can lead to very less or more serious adverse drug reactions, or interactions. On the other hand, if the physician just prescribe a medication without informing the patient why is that prescribed, what can they expect, what the side effects might be, and what they can do about it, for how long they should take, and so on, then obviously that can lead to a lot of problems. Mm-hmm. So again, yes, communication, it is a very important.
Because it's an overall whole health kind of approach.
Correct.
That both should be, you're responsible for your own health, but we're hoping that we're seeking some guidance and direction and information from our healthcare provider.
Correct. It takes 2 to tango. So it is a both.
Even in medicine, yes. Well, I think the other thing I mentioned before, and that sometimes we maybe either don't know what to communicate, or again, as you said, maybe don't think it's important. As you gave the example, some people say, well, how does going to my eye doctor and getting an eye drop affect my visit with the cardiologist or something else? And I think so we don't realize that it is important to share all the information. And in other cases, I always say that my mother, when she goes to her physician, the physician asks, how are you? And her response every time is, I'm fine. And that's where we stop, and we don't really gather, well, but how does that make you fine from the last time I visited? Do you, are you feeling, did you ever have certain episodes, dizziness or whatever? And I think we just that's kind of what we end with. So we can see how we can further along our own care and our own health in opening up the dialogue and getting good communication, and then and we're going to talk more about medications now, because that's really a problem in some cases. Right. So I know that you're going to help us to quickly understand, because I know with the pharmacist we're going to talk about some specifics on medications and when we talk about filling and questioning. But we've got, and we're really talking about prescribed medicine, but there are over-the-counter and others. So we have all of that mix. But what would you say, you're prescribing some things for a short range, short-term, acute, something like a cold, or something long-term, a chronic condition we might have?
Correct. So, how do we decide when a physician makes a decision regarding prescribing a medication? No, it is a very complex process. It's not just, I have this problem, here it is, a pill.
Okay.
I think that would be, it's extremely simplistic. And the reality is that the more advanced in age a person is, the more complex it becomes. You're young, you don't have many problems. Young people have a lot of resources. The body has the resources to deal with problems. They're not so sensitive to medication and illness in general. It might be less complicated. However, as we advance in age, the body changes such that it's more sensitive to medication in many ways.
Okay.
There are changes in the, again, with the normal aging, where the effect of the medication may differ. It may be under or over. The effect may be decreased or increased.
Okay.
The metabolism of medication differs, and you may retain, and that may lead to side effects, because the concentration may be higher in patients that are older, because they cannot get rid of the medication as easily, so they cannot metabolize it. So the kidney and the liver are not working as well. That and the third thing is patients are more sensitive in general to side effects. Like they say, they're more likely to get confusion, or they're more likely to get side effects with certain medications. So on the other hand, the more we advance in age, the more conditions we have now. This is where the chronic conditions really build up. But not only, but there are more functional impairment.
Yes.
Hearing, not feeling your, what you have, you don't seeing very well. A lot of conditions that are associated with aging, like memory problems, incontinence, they all add up to the complexity of this decision. The last, everything comes with a lot of medication chronic medication that person has to take. And again, when you make a simple decision, like let's say I have pain, but how do you treat it? Here's a pain pill. In a very frail person, it may be a very, very complicated decision. So that's why, the amount of information that the physician, we have to give that physician, depends on, again, how complex the situation is.
Yes, and that is something that I think we just don't think about.
Correct.
And hence I think it's not that we're necessarily wanting to withhold information, but it's, I'm thrilled that you explained it that way, because I think it helps us understand. We don't understand, we know we're changing as we age, but we don't really connect those dots. And explain it the way you did in terms of understanding how things relate. So you have some of those chronic conditions on long term, so even more important that if it's a regular primary care physician or any of the specialists we might see, it's very important to have a good communication with them and explain about medicines that were prescribed by all of those folks that we might be seeing, right?
Correct. And actually it is, at the first visit, most of the patients have to be ready to give as much information as they can to the primary care, as what the past medical history, what previous problems and current problems they have, what medication they take, including the over-the-counter, including the supplements that, They have to have a list of the adverse effects, like not just allergies, but what happened when I took that antibiotic. I might have gastrointestinal problems or so on, and not just call it an allergy. They may have to, certainly have a current list of their medications when they go to the physician, no? They have to tell the physician what other physicians they are seeing, a list with the specialist, and when are they seeing them, and not forget to tell them, can you please send a copy to my primary care?
And they will do that? Okay.
And they will do that. And
All right.
actually, with the event of electronic medical record, that is a little
Since it
better.
makes it simpler.
Yes, it's going to get a little better.
Because even with that, I might have the list, but I'm going to forget to change if it changes a different type of generic, if that matters, or even if a dose changes sometimes,
Correct.
I forget to make that change.
Correct.
Sure.
And also, to provide the physician with information regarding your function and your resources and what you can and you can do. It's extremely important.
Explain
because
that a little bit more about your function and your resources.
So if you don't see, or if you don't hear, or your mobility is very bad, or you don't feel very well, it's going to be a problem if I prescribe to you a medication that involves a lot of, multiple dosing, or giving you a shot, or using a very complex, let's say, inhaler, and so on. So all those informations, you need to give information about, can I do it myself, or why can't I, or is somebody available to help me with that? And that's something that physicians should think about.
And it's so simple for us to remember to do that. I'll give you an example. I have a very small pill that I take daily, and now I get to cut it in half. The doctor reduced the dose, but that doesn't come in a smaller dose, so the permission has been given to cut that in half.
Correct.
Well, it's like this big. So yes, if I had real difficulties figuring out how to pick that up, and kind of get frustrated with that, it might be as simple as saying, is there a different format? Maybe a liquid I could pour?
Correct.
Is that okay?
Yes.
All right. So that's good to be open about the functions and then the resources,
Correct.
as you said.
And another thing that I think it is very important is to tell your physician what your expectations are. And what your...
Now, there's a new buzzword for us folks who are going to doctors.
Correct. What it is that, it's important to you. Because that makes a lot of a difference on how, how aggressive we may treat a certain, or how many chances do we take. It's always a balance between side effects and and effect, and we need to balance that, and the patient's preferences should weigh, and the choice should weigh a lot, So it's very well that it's very important that the physician knows what your goals are, and what a life worth living is, and what is important or not to you when the treatment is decided on.
So that's really anything from. I have a friend who has some multiple health conditions, and there are times that she has gone to her physician, and in the discussion he'll of course want to prescribe a certain medicine, and she usually says, no, I don't want to take that. So she's obviously being upfront and indicating to him that this is something that either, I don't know if it's that I don't want to take the medicine at all, or I won't take it because I've tried it in the past and it didn't seem to help with anything. Or sometimes, people will say to us in our agency, I take so many meds, I just can't take one more. So I think, if the patient can share that with the physician will kind of look at that a little differently. And maybe that's where that communication comes in. Maybe an explanation about that particular medicine and its purpose.
Correct.
And again, what side effects, but that might help for me to understand. And then also stick with that decision, no, or maybe I will try it. So it might go either way depending on with more information from the physician.
Correct. Now the physician's role is to inform the patient so it needs to be personalized. I think that one of the challenges on the physician side is that the patients in front of you are very variable in what the expectations are from the physician. Some just expect the physician to tell them what to do. No. Some, on the level of understanding and education in general, some maybe no more than others. And third is, the willingness to actually participate to their own You know, some people are more hands-on. I want to make my decisions and I want to understand, and some are a little more passive. So I think the physician needs to find a way to involve all those three categories of patients in making their own decisions, because it has been shown that if the patient doesn't understand why the medication is prescribed, they're not going to take it. And, you know, 40 or 50% of the prescriptions end up not being filled because of that. So, and not, you know, so I think this, again, we come back to communication, but is this partnership that needs to develop between the patient and the physicians, where there is a discussion on, okay, what is the problem? What are the possible answers? And maybe medication is not the best answer. Maybe we can deal with your pain in other ways. And if it is, what it is that, you know, how much relief is okay for you, you know? Maybe you can put up with a little more symptoms and avoid certain side effects that are there, and so on. So this is a partnership. You know, both physician and the patient needs to sit and think, how do we solve this problem? It's our problem, to have ownership over that, a decision. That's how I think we should go towards.
And what then makes that good partnership? What do you think is the best way? What makes that a good relationship between patient and physician?
Well, certainly the patient needs to be sincere, needs to trust their physician, and they need to respect the physician.
Well, I think, you know, and I think with that is, again, it goes back to the expectation that I want. And if I come to the physician and I don't share some of this information because I don't trust them, then that's not going to help our communication and me in the long run with my health.
Correct.
So certainly, and quite honestly, from this perspective, if it doesn't work, I have the option of choosing another physician that I feel more comfortable with, you know, that I feel that we can develop more of that communication, the dialogue, the relationship, that I'm able to talk about issues, habits, etc.
Correct.
And then from that physician,
the physician perspective, certainly respect is first. You have to respect your patient. You have to know them. You have to really be genuinely interested to get to know the person and to look at the person and not at the patient. The third thing is to be empathetic. You need to try to understand very well where they come from, what it is important, what is not, and so on. So, and to educate. No, to actually tell them and guide them towards, you know, I think the physician needs, that's the leadership here, and they can, you know, teach them, first of all, explain that as a situation. Listen, this is a type of relation we need to have, and I think this is to your benefit. I expect you to get involved. You know, it is your life, it is your health. I'm here to help.
I'm glad, because coming to my mind was a situation recently of my physician sat down and you know, educated me about a procedure or options, and drew pictures so I had a visual, and then said, you could do this, you can do this, or you can do this. This might lead to this anyhow. Or we can do this, and she said, what type of person are you? And I went, oh, I'm skipping all this and we're doing this, you know. And that was nice. It was good. We were working together. She was educating me and allowing me to make that decision, and she didn't say, are you sure? No. So let's move on to, you know, again, that special, we want to have a good relationship. Let's move on into the medications. I know that you had some excellent information of tips and things that we should be, that we could be asking or following with regards to medications. So what would you like to share with us in terms of medications to ask or to know?
Well, certainly when a new medication is prescribed, you have to ask the physician, and the discussion needs to take place on what is the expectation, what is that we treat, and why do I take this medication for, and how would I know that this works? That would be the first thing. If it doesn't work, you know, what are we going to do? Are we going to stop it? And if it is like that, most of the time you have to have another discussion with your physician and not stop it on your own. What are the side effects? No? If there are side effects, what are serious, and what should I do about it? When should I call you? Is this medication interfering with other medication that I take? Is this medication interfering with other problems that I have? Because
we don't think about that. Yeah.
Correct.
I think we think that maybe you're handling that as the physician, so we don't even think to ask how does that relate to.
Which is true, and again, it needs to be a back and forth. We are. So yes, this is the physician's duty to ask themselves all those questions. But again, I think it is, there is a lot of there is a limited time the visit is there, no?
Yes.
So many times we as physicians assume that you know about certain things. So that's why it's helpful to actually ask the questions when you don't.
Well, I think sometimes it's confusing because if we ask about the side effects and what should I watch for, and what happens if I don't take the dose, and should I double up, should I not? We don't want to over medicate, but we want to be on track. But sometimes the side effects we don't feel or know, and it's a good side effect. And I always go back to blood pressure medicine because that's something that we may have had symptoms if the blood pressure was high or low. And now that we're, let's say high, so we've talked to the physician and you're starting on a medication, but I don't necessarily feel
the effect. Correct.
Which is bringing it back in line, and so you question, well, why do I need to keep taking this? But if it's explained by the physician, then we understand that it's doing so, and that's why we need it, and don't just stop and things like that.
Correct. It's exactly what I mean by asking what the effect of why am I taking it and how would I know it works? In the case of the blood pressure, you wouldn't feel it works, but we can measure. Well, what are the side effects? And what happened if we don't treat it? And again, those decisions, the more, in very frail patients with a lot of medical problems, the decision may be different because what is relevant at 40 years old, like let's say treating cholesterol when you're in your 40s, may be different than when you're in your 80s. It may not be so relevant. So the benefit may be minimal and the side effects may be more. So that's why those questions and those discussions need to have place. And again, is it initiated by the physician or by the patient? I think it is. It's a dynamic, and it needs to come from both ways because it needs to be an interest from the patient side. As a physician, you say a lot of things, and you don't always know what the what it goes through and what doesn't.
In terms of medications and taking it and expecting side effects or not, I think you said something early on, and I think it would be good to emphasize too, is that if something happens, whether I feel the side effect and don't like the side effect, or I skip a dose and I don't know what to do, it's okay to call you.
It's absolutely okay, and not only, but it needs to be rediscussed at the next visit because there are potential side effects, and not everybody is the same. And I don't think we know everything about side effects, and this is one of the challenging for us as physicians. There are more and more medications on the market. There are more indications for the medications. There are more over-the-counter medications that patient can take on their own. The booming, market for the supplements and the vitamins and that can complicate the picture. And there are formularies and cost involved, which again, it's a big issue, no? So it is a very complicated issue when as a physicians how we make those decisions.
Okay, good. So I think that's good to know that we don't need to wait to the next appointment. But I think in order to help the communication at the next appointment, maybe I could jot some notes down. About, geez, I'm having a hard time picking up that pill, or this is how I feel. How long will that side effect last? Is that something I'm going to expect now that I feel it for a long period of time or not?
Yes.
And that's good to either make notes for our next visit and also know that anytime these medicines are prescribed, I can call the physician office and ask those questions
Correct.
and get those answers.
You should always, I think the discussion needs to have place at the next visit on how is this, did that work?
Yes.
What were the problems? Should we continue or not?
And I think we, as the patient, have that obligation to keep that relationship working by being prepared to answer those questions.
Correct.
Gee, yeah, it only seemed to bother me once or twice during this period of time. I think I can manage that as long as it's doing this for me.
Correct.
And working that way to look at the medicines. And as you age, we don't have a lot of time, but I do want to, you mentioned something to me earlier off camera, was about you called it prescribing cascade.
Correct.
Could you just take a minute to explain that? Because we were kind of right on that at this point, I think.
Correct. Yes, that's something that happens very commonly, mostly in elderly people, because you see that it's very common that taking a medication can lead to a symptom. So let's say it's a medication that can give you a headache or incontinence or confusion or stomach upset or diarrhea. And the next thing you go to your physician and you say, well, I have diarrhea. So unless we think, okay, so the first thing we should look is there any new medication that can explain that symptom? Because otherwise what we do is we prescribe a new medication for this. And guess what then? Maybe something else happens and we prescribe a new medication and so on, and we keep adding medication to treat side effects from previous ones. So this is something that happens and we need to be aware. Okay. So that's why it is important to actually tell your physician whatever medication changes have been made. Stopping on medication may have the same effect because, if I assume you take something, I keep it, it's in my equation when I make a decision on the new one. So not taking one and not telling me might be a problem.
Yes. All righty. We have just one quick minute. So I also know that there's some resources out there as far as things to ask and questions to ask with regards to medications, and I will look for that. But I need one last, if you had 1 minute to make kind of a plea to those of us who, again, focused on seniors or older adults and medications and a physician-patient communication relationship.
Well, if one thing it is, if I would like to emphasize, I think the relation between the patient and the physician is very important. I don't think anything can happen if, us as physicians don't see the patient in front of us as a person, if we don't get to know very well, what their problems are and the issues are. When it comes to very frail elderly, we need to be able to try to think about functions and help and go beyond just medication. And again, to be empathetic and to understand and to get to know the patient's preferences for care and the patient's preferences, for the quality of life they want to have. On the other hand, as patients, we need to take more ownership of our, we need to want to understand what's going on. I
be
think
a participant.
To be a participant, we need to try to understand as much as we can what's going on and not be passive, because I think that's where we go. I think I think it's extremely important to really be efficient, to actually, mostly in those situations when there are a lot of medical problems and conditions and advanced frailty and problems, it is very hard otherwise to obtain the best you can have, the best health and the best function you can have, unless those are the relations.
So to kind of sum it all up, obviously that having that good patient-physician relationship, open communication and dialogue will really help both of us to maneuver through our life and our life challenges, our health challenges throughout our lifespan, but particularly those who are older adults and seniors. So I want to thank you for tuning in to Medications in Seniors, in particular communication with your healthcare professional.